Hello, this is Dr. Gay from First Look MRI. And this is a 74-year-old female with medial-sided knee pain, and she has a prominent finding here in the medial tibia. So this is the articular surface, the horizontal line, and right beneath it there's another horizontal dark line. Not as clean, but this is a prominent stress fracture, subarticular stress fracture of the medial tibia, and around it we see this foggy area of increased signal. This is marrow edema, and the fracture line is here. Luckily this is not collapsed, but if this is left untreated, the articular surface can collapse and drop, and then they may need a knee replacement, but we're catching it now before that has happened. But a really prominent stress fracture we can see on the sagittal view here. The patient in profile, we see the kneecap here in the front, the femur up top, and down below we see the tibia. As we go off into that stress fracture, we see it right here, a really dark band. And when we see a fracture like this, we always look for the meniscus to see if there's a meniscus tear. And in this case, they do have a meniscus tear. And this little triangle is the meniscus body looks normal here. But as we go towards the back, we see a tear in the posterior horn. So this is the normal posterior horn of the lateral knee. And we can see right here this patchy area of brightness. This is an irregular complex tear here of the posterior horn of the meniscus. And when the meniscus is torn, it doesn't do its job of adding cushioning and stability. And there's a bone-on-bone configuration. Lots of stress will be from the femur distributed onto the tibia, and they develop these stress fractures. So we see a very common finding, a very prominent stress fracture of the medial tibial plateau with no articular collapse, prominent marrow edema, and this is related to a complex tear of the posterior horn of the meniscus. Here's the anterior horn, and we should see a mirror image triangle here, and we do not. So this is that complex tear of the posterior horn. Thank you very much.